Good morning. You are welcome to Health Guide. My name is Dr. Isa Tosin. We are still on understanding menses, and today we begin to look at quantity of blood flow. As a woman, and for our mothers and our experienced career ladies who have been menstruating for years, this important aspect you need to understand. You must be able to determine the quantity of what you lose each month. And I want you to sit back this morning. If you're a man hearing this, you can collect this and send to your children or your wife or some of the women around that always have a lot of complaints all over. The quantity to be determined is very important. You see, some of us are women menstruating, and after menstruation, they are always tired. Or during menstruation, they are very tired, weak, or having some fainting attack, having some fainting spell. They are unable to discover or to determine that what they are losing is actually too much, or sometimes it is too small. But today we are telling you what is a normal quantity of flow. So as a normal flow, the spectrum is that every woman that loses blood in a month will lose about between 5 mils to 80 mils. And that means that if you take a tablespoon full, that we're looking about maybe between 2 tablespoon to 6 tablespoons, that's going to be the quantity of blood loss in a month. So that's estimated to be maximum of about 80 mils, between 5 mils to 80 mils. So that is the usual of the quantity. But this may also be difficult to also determine, as some women who probably lack the capacity to have the method of estimating blood loss. So this will take us to what we use, what our woman uses in order to actually manage the menstrual flow. The first thing most people do not know about it, they can get use of, is menstrual cup. Menstrual cup is very, very objective because it has a graded line on it. So if you use menstrual cup, you'll be able to determine the quantity of blood you lost. But that may be difficult and not affordable or not even available for so many of our women in this particular climate. However, we use tampons. And our tampons also is made in grades. There's a general light tampons. There is a thicker, heavy tampons that is better and absorbent. Now, each of them has what they can actually contain. What they contain, if you are using the light general one, what it can soak in maximally is just about 3 mils of blood to 5 mils. But if you use the thicker one that has a higher absorbing capacity, it can actually contain up to 10 mils to 12 mils of blood and before it gets soaked. And there are other ones of higher grade that you can actually use overnight because you want to sleep. So it can actually contain almost 15 mils of blood that will be comfortable, and you'll be able to sleep all through the night without you having a particular problem. So these are ways to determine the quantity. So if, like calculation, let me tell our women to get this very clear. If you're using the light one, so you want to determine what the quantity of blood you have lost. So you take the number of tampons you have used throughout the menstrual period, you multiply that by 5 mil, and you multiply it by 0.36. Again, let's all work it together mathematically. If you use 5 tampons all through your menses, and if the light ones I'm referring to, when we said what it contains about 5 mils, between 3 to 5 mils of blood, so you multiply that by 5 mils, that's going to be 5 by 5, that's 25. Now you multiply 25 by 0.36, whatever it gives you is the quantity of blood you have lost for that particular month. So this is a very classical formula that you might not need to go to hospital to do a PCV. You'll be able to know automatically that I'm losing too much blood, or I'm losing normal blood, or I'm losing too low blood, and that gives you very good information. So menstrual flow, in terms of the quantity, you need to determine that in order to sustain your health. Stop using blood tonic continuously, because if your loss is not that much, you end up using the blood tonic to injure your liver, and that can be very dangerous. So until we come your way again, you can still reach us on 08023311868. You can ask questions on our WhatsApp handle, and we can give you an answer as the case may be. Thank you for listening.